Can we start?
Yes,
Yes. Can you tell me where are you from?
I'm from San Ramon, California,
Oh,
U.S.
U.S. Yes. What's your name?
My name is Nestor Bonifacio.
How do you know Fuda Hospital?
I found out about Fuda Hospital back in August when Dr. Xu went to Baguio for a seminar. My brother Domingo, when he found out that I had cancer, he did a lot of research for me to get the cure. So he went to Baguio, meet Dr. Xu. And there's about 600 cancer patients that attended the seminars. When he came back, he called me and said, I want to bring you to China. This is a good doctor, this is hospital, this is the solution for you. Then what happened was, I did not believe him. I did not believe Fuda Hospital. I know he went there, but nobody we can talk to that he had been at Fuda. So my brother took 8 months to convince me to come here. Only after my doctor in the U.S. started telling me that my cancer, my prostate, is growing, and that the next treatment that they're going to give me is chemotherapy and radiation. So my brother said, I don't want you to go into radiation, I don't want you to go into chemotherapy, but I said I cannot travel because at that time my hip, I have a fracture on my hip, I was in pain, I cannot walk, I cannot even travel on the airplane. My brother told me, I will bring you, I will be there, if I have to lift you to bring to China, I will do. So then, when I had that surgery, all my siblings went to see me. Guy from Canada, my brother, and then from Florida. We are 8 in the family, 3 girls and 3 boys. So they all came when I was in the hospital. And when I was in the hospital, my brother wanted to tell my doctor, my oncologist, and he said, I want to talk to the oncologist. I want to know exactly what they're going to do to you. It looks like there is no aggressive treatment you're receiving in the U.S. I want to bring you to China. And I said, no, I'm going to stay in the U.S. U.S. is the best for medical treatment. So then, when I was in the hospital, my brother said, I want to see your oncologist. So I arranged a meeting with my brothers and the oncologist. So my oncologist went to see me. And my brother said, you tell me and be honest with me. Are you going to cure my brother? And the doctor said, no, we don't do, we cannot cure cancer here, we can treat. Slowly, you can treat, but we're not curing cancer in the U.S. So at that moment, my brother told me, have you heard about Fuda Hospital? And the doctor said, I don't know about China, maybe there's something good in China, maybe doctors in China, they're good, but I don't know. So when he told him that, my brother told me that, well, let's go there, because at Fuda Hospital, their treatment is to go after the cancer, so that the cancer will die. And he'd been talking about cryosurgery. At that time, I don't know what cryosurgery is, but he said, they're going to do something to you, they don't even do a surgery, they will kill the cancer. So I was thinking, maybe I should consider this. I felt that if I still have 2 years to live with my cancer, and Fuda, but I am in pain. So I'd rather live 1 year without pain than live with 2 years of pain. So yeah, okay, well, let's go to Fuda. So when I go to Fuda, my expectation is even if Fuda can only extend my life by 1 year, and that, but it's not painful, I would rather go to Fuda and stay in the U.S. where I'll be in pain for 2 years. That was the decision I made.
How is your PSA?
My PSA when I went here, I think the first test when I went here was 8.8, but it was going up, and then my PSA started going to 14, 12. At that moment, at that time, I was taking some medicines that the University of California, San Francisco, one of the best cancer hospital in the U.S., I have been diagnosed by, I've been checked by doctors in Stanford. But at that time, I was going to clinical trials. They want me to go to clinical trial. They did not specify chemotherapy. They do radiation, but there's some breakthroughs in prostate cancer. But then when I went there was no available trials because I wanted to be on the phase 3 trial, not on phase 1. But there was no available. So at that time, they gave me a medicine for the cancer, which is called ketoconazole and hydrocortisone. When I took this medicine, I don't know if it's side effects, but what happened to me was I developed some, I cannot sleep. For 3 months, I cannot sleep. Maybe I sleep 2 days. Then along with that, I don't have the appetite. I cannot eat. Then along with that, I have stresses, anxieties, and depression. They want to send me to a psychiatrist. I was thinking, if you send me to a psychiatrist, I go to the mental hospital. No, that's not good. I may lose my driver's license. So I said, and then I have, along with that, I don't want my relatives to visit me. I don't want them to come see me. I don't want them to talk to me. And no phone call. I don't want to. I don't want to watch TV, and I don't want to check my email because my brain, my memory is going down. At that moment, I was ready to go. I think it was hopeless. I was planning for my death. Until this came, when I got the surgery and all this came about, and I see hope. I was very happy that we're here. I think everything that I doubted before I came here, it was totally reversed. The doctors are good, much better than the U.S. The nurses are good, much better than the U.S. The services I receive here, your attention and caring is very important for the patient. And yet, that was lacking in the U.S. When I am in the hospital, I'm lucky my doctor will visit me one day. They are hard to call. They always go to the advice nurse, and then you cannot talk to them. You are in pain, you are already in the emergency situation, you call them, you cannot call them. This is a totally great hospital. I think this hospital is designed for everybody. I think there is hope in the hospital. Anyone who has a cancer, diagnosed with cancer, this is the best hospital, and I can vouch for that.
Thank you very much.
Yeah.
Yes.
The important thing is, you see people who are caring for you, they love you. You love your patients. You care for them. That's very important for the patient. Yeah.
Yes. Yes. Did you receive any treatment at our hospital? No.
Here?
No. Here, yeah.
Yeah. The first thing that they did to me here is, what we did was, my brother, he said, even if you don't want to go to FUDA, I want to get your medical record. So I sent him the medical record, and then he sent them to Dr. Shu, right? Dr. Shu reviewed my record and said, bring your brother here, we can help him. I said, no. Then I consulted my oncologist in the U.S., and I said, I want to go to China. I showed them the website. He didn't even to look at it, but I showed Dr. Shu's email. And doctor said, that kind of cancer, you need 2 treatments. They have a leading hospital for cryosurgery and CIC, and he said, we can help your brother. And so what we did was, after Dr. Shu wrote my brother an email, he sent it to me. So I showed it to my doctor, my oncologist. There's an email from the hospital president. What do you think? The oncologist said, that is a good email. But that was the end of the conversation. He did not encourage me to even look further. And I said, his recommendation is great, because your situation, you need 2 kinds of treatments. Then he didn't even want to talk about cryosurgery. He didn't want to talk about combined immunotherapy. They would not entertain China there. It's just that they don't want.
Yeah. Do you feel better now?
I feel great. I think there is no time that the only time that when you did the surgery, then Dr. New did the cryosurgery. So immediately they brought me to the operating room. So they prepared